a piece of advice to people in public health or students is find something that you enjoy doing, but that you can get paid for it. And that's not maybe the right thing to say. Maybe it is or isn't, but it's just the truth. And because if you can't get paid for something, that's wonderful. We don't need to get paid for everything, but that's might be a hobby or something we enjoy, And so I found this kind of gold place that I really like to this day. In fact, I even love it more and more all the time, doing needs assessments and improvement plans with health departments and hospitals. And so I found that. And the way that Dr. Huntley described it to me, I'll never forget, and I use this constantly, was like, well, if you had an issue with your ear, who would you go to? Would you go to your, general family physician, or would you go to a ear, nose, and throat doctor? Well, of course, an ENT. I got to go to a specialist. And she was like, so Moxley Public Health has taken a turn, but the last 4 or 5 years, it's been about needs assessments.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. Stephanie Moxley is the CEO and founder of Moxley Public Health. They work with hospitals, health departments, and other organizations to collect and transform data into actionable results. She's a mom of 4 daughters. She's a public health professional passionate about understanding communities and facilitating the improvement of that community's health. She conferred a Bachelors in Sociology from Hunter College, worked as a co-coordinator and health educator at Bronx AIDS Services before getting her Master of Public Health degree at Boston University. She is the CEO, founder, and public health consultant for her company, Moxley Public Health. In today's episode, you'll hear and learn more about founding and being a CEO and consultant at Moxley Public Health, the importance of evaluation in her consulting work, the community needs work she did in Blue Mountains, Jamaica, as well as the important role of health education in public health, and much, much more. And quick reminder, the community waitlist is still open for the February 14th launch date for the community. If you've been searching for community, career guidance, or just really want to build your public health brand, you do not want to miss this. Be sure to join the waitlist below or at thephmillennial.com/waitlist. Look forward to having you there. Back to the episode. Enjoy.
Hey, this is Stephanie Moxley. I'm a public health consultant and founder of Moxley Public Health, and you're listening to Public Health Careers. Before I was recording with you, I was texting with my friend, Giselle Martin, and she's actually going to be on your podcast. I didn't know that she even knew you, and she said that she referred me, but I wanted to give a shout out because I think a lot of people don't realize that she has cookbooks. I have one of them for sure. I thought she had a second. She's definitely about to release a new one, but it's on plant-based cooking, but like soul food. So really plant-based cooking. And I truly use it a lot. And so I was just saying that to her, but it was just kind of a small world funny thing because I was like, hey, do you know him? She's like, yeah, I referred you every Friday. But yeah, but I'm going to probably cook one of her recipes tonight. So it's really good. I can really highly recommend it. So she's looking for a photographer. So if anybody knows a good photographer, good food photographer.
Awesome. That's awesome. And it really is a small public health world. And I did not know that she made cookbooks or plant-based cookbooks. So I'm thoroughly excited to learn more about her cookbooks. Links will be in the description if you're interested, as well as have that conversation with her and hear more about her thought process on that. So thank you for bringing that up. And I'm glad that she recommended you as well.
Thank you.
Welcome to the show, Stephanie. I am so glad to connect with you here today.
Thank you. Thank you for having me.
Yeah, it is my pleasure. It's been a long time coming. Been loving seeing the work that you're doing. It was great to meet you at APHA last year. And so I'm looking forward to hearing more about your story, how you got to doing all the work that you do, and just learning about that career progression.
And can I ask about your story
Of
too?
course.
Okay, good. I first want to say, and I mean this from the bottom of my heart, that it was really busy and probably didn't pick up on this when you visit our booth and at APHA, but you have a very calming presence. Like, I liked to be around you. And
Awesome.
so I don't know if people have told you that before, but it just felt like really at peace, and you just like get those vibes from people.
Well, yeah. Thank you. That's a great compliment, and I will take that for the rest of the year. I'm gonna write that down somewhere. Uh, I've been told that people think I'm a lot more serious than I am. I don't know. Online, I look like I'm serious, but like in person, I'm not very serious. So that's been the biggest thing. But I appreciate that.
But I
I
remember
tried.
I thought that in the moment. I didn't even think that later. I thought, I don't know what it is. Like, but I feel really good around this person.
Awesome. Well, hopefully we can create more spaces to connect like that.
IPHA, so that's a lot to say.
Right. Well, I hope that we can continue to connect like that going forward. So before we get into anything, I'd love to know, how do you identify, and then tell us a little bit about your personal background.
Yeah, so she, her. I'm from Ohio, where I live now, but I moved away for 25 years, and I moved to New York City. I think that's a story of a lot of young people. And so I went to school for sociology at Hunter College. And then I learned about public health, I guess, which we'll talk about later, maybe in my job at Bronx AIDS Services. And then I moved to Boston for grad school. I went to Boston University School of Public Health. And I lived there for a long time, had my first job at John Snow Incorporated. Then I moved to Denver, and I lived there for 11 or 12 years. I worked at the Denver branch for John Snow Incorporated. And then that is really where Moxley Public Health was born, in Denver. Speaking of born, also all my 4 daughters were born in Denver. And then we lived in Wyoming for a year. And then now I'm back in Ohio, where I came from.
Wow, that's a lot of travel there, and to a lot of various places around the U.S. And I can imagine that those experiences have been very enriching to your life, as well as just to your family's life as well.
Mm-hmm. Definitely.
And talk more about how do you, because we're gonna dive deeper into your story of you starting this consulting agency and doing all the work that you're doing, but you're also a mom of 4, as you just shared. So how does that intersect with all the work that you're doing?
Well, so it's, for instance, right now, my kids are at school. So I start the day kind of early because before they get up, so I get a lot of work done. Also, that's a good time for me. My brain is fresh. And then they get up, I help them get ready off to school. And then really, I don't take a lot of meetings. I work after 3:15 or 3:18 when they get off the bus. But as you know, I was looking for daytime spots because the house gets really loud. And I do work from home most of the time. And so the house gets wild, and the dog starts barking, and it just gets nuts around here. And so how do you want me to go back a little bit? Because it was how sort of Moxley Public Health started being
Sure.
Yeah. So I was at John Snow Incorporated. I loved it. I have nothing like that job was amazing. And but it didn't really work when I started to have babies. And so I slowly left John Snow, and I was consulting on the side, and that's where Moxley Public Health came from. But for many years, I was really consulting very, very part-time, and mostly as an evaluator. Back then, I still definitely wear that evaluator and monitor hat, but back then I was the evaluator on a lot of projects and acting as a consultant. And I realized that I didn't really care about a name of my consulting business, but I think you have to choose one to get paid. So, so I chose Moxley Public Health in about 10 seconds, and it's still that to this day. And So yeah, and then I several years ago when my kids were all gonna be in school all day, I really started thinking about what it would look like for me and what it meant for me to go take my career and professional life to the front seat.
Awesome. And we will dig more into you getting to Jon Snow and a little bit more about that transition in that week. But it's good to hear that like you didn't just rush into consulting. It was a thoughtful process that you thought about. You were able to do some evaluation work while you were building up your skill sets before getting and becoming a full-time consultant and all of that great stuff. And more recently, from APHA, I would be wearing the t-shirt right now, but it's dirty. There was a pink t-shirt. I believe it says "Eat, Sleep,
Public
Eat,
health.
Sleep." Right, Eat, Sleep, Public Health, Repeat. And I love it. I love the material also, by the way. So that was in support of the work that you were doing for the Jamaican Blue Mountains Community Health Assessment and Improvement Project.
There was
Can you
another
talk?
one, in case anybody's interested, that says it's a public health thing, and only public health people will get that. That's why t-shirts hot. Yeah.
Love it. Love it. You were selling those t-shirts in support of the Jamaican Blue Mountains Community Health Assessment and Improvement Project. I know when I was speaking to you at APHA in Atlanta, you were talking about how you had a connection from sometime previously when you were in Jamaica, and you just kept that connection throughout the time. And now that you evolved into doing this consulting work and having the skill set to provide like work around community health assessments, you decided that this was something that you wanted to do. So firstly, just like give us the runway of like that project and like how did it go? Because I know after APHA, you went to Jamaica for a bit. So tell us more about that.
Thank you for asking about that because I love talking about that project. So actually, that started over 20 years ago when I did my internship in that community during public health graduate school, and I remember my friend and I went there, my friend from public health school, and we did a health education I guess, program for the young ladies in the community. And after that, I just really stayed in touch with the community in different ways throughout the 20 years. And I would go there every few years to do different things. I was on the board. It's since dissolved, but there used to be a nonprofit that served that community right there in the community, and I was on the board. And so I would say a few years ago, but it really wasn't even a few years ago, I was driving down the highway because I do my best thinking when I'm driving. When I was driving down the highway, I had already thought about an improvement plan and a needs assessment in the community. So the background of that is I have a really close friend that lives there named Cheryl. And Cheryl and I would talk about just everything and including our work, of course. And so it occurred to me when I was talking to her that what this community needs, because she was talking about doing outreach for like fundraising and things for the work that she does there. She's a community health worker there. And I thought, well, geez, there's no data to get support and to get money and everything and resources. You really need data. And it just kind of went off. I'm like, why don't we do what we do as a company in this community in Jamaica? And that's how it began. And so when I was driving down the highway, I was really thinking about that. And all of a sudden I was like, what are we doing? Like, we got to stop waiting for the perfect moment to start this, because they need this sort of, like yesterday. And so I think that I was texting, it was a Saturday too. I was texting my team being like, okay, we're doing it. Like, let's get going. And so that's how it came.
Firstly, it's important to have space for ideas to come to us, whether that's driving on the highway or being in the bathtub. But many times we have, when we're just in like idle time is when our best ideas kind of come to us. So
what's yours?
I also think a lot when I'm driving. Many times I don't drive with music on, as well as I'm trying to get into the habit of walking more and walking with like intention of just thinking and not doing anything else. but it's a little cold as well. So trying to bridge that gap.
Where are you? I looked at your bio and your stuff, but
I am in Winston-Salem, North Carolina.
Okay. Yeah. Well, it's not as cold as in Ohio, but I hear you.
Not at all. I did find my puffy jacket yesterday though, so that makes it a lot easier because I didn't have my puffy jacket before, and it was rather cold the last couple of days. But yeah.
Just when you just giving your, that's all I was just agreeing with you that just, I think it's just about giving whatever your setting is to give your space room to wander. I always say like wandering is really important for our brains and especially visionaries to have ideas.
Yeah, absolutely. And it's actually a point I was making yesterday at the public health happy hour that I had is that computer screens and our phone screens have just taken away so much of that empty space that we used to have of just like thinking and doing nothing. So really trying to cultivate that into our lives, I think is just so important and sets us apart from most people and just like not being bombarded by information, but being able to actually actively think for ourselves, which I think is important.
Mm-hmm. I agree.
Okay. So the idea came to you throughout your ideation process. You decided that let's not wait. Let's just do this because there's this need. We have the skill sets. Like the time is now to do this. Mm-hmm. What was the next steps in doing that work?
Yeah. So you're asking how it went. The next steps. So for several months, and also it was just because we couldn't, while we kind of decided what the next steps were, but we knew with every project, we start with secondary data. So existing data. So to assess, we assess basically all the health needs and social determinants in the community, social determinants of health. So that we knew that would be our first step, and it also gave us room to kind of figure out what the next steps were for this project. That was a little bit of a challenge, I'll tell you, because it's already a challenge in a place like the United States. Collecting secondary data is like all the sources online, just fishing through data sources to find stuff. But it was really challenging in Jamaica because a lot of well, first of all, there wasn't data for a lot of stuff. And if there was data, it was 10 or 15 years old. And so we have actually an internship program called Women Supporting Women in Public Health. And the interns were doing a lot of the secondary data collection, and they, kept coming because they were just so concerned, like, oh gosh, I thought they were doing something wrong. I can't find anything. And like, oh man, it's 10 years old. And I was like, welcome to international health. Like, that's okay because there isn't anything. You've done a great job. You just kind of do what you can to get the lay of the land and see what's, let the community tell a story the best you can. And then for the next several months, we talked to you just a few days before we left for Jamaica. There we did primary data collection. So we did a lot of talked to hundreds and hundreds of people. And so that what I learned from that was that looked really different than other communities, especially here in the US. We had a survey already. We had the interview guide. And really what it came down to is we ended up scratching the survey. It also was affected by that there is low literacy levels in the communities that we're working on. But really, it's just as a culture, it's more about more than everywhere is about relationships, but even more about conversations. And we have good relationships with people in the community. So that allowed us to have good conversations with people. That would not have happened if we didn't have those existing relationships. So we did a lot of talking with community members, community leaders. We visited the health center there. We also looked at hotels because for next steps, as we're working on the improvement plan, we're still talking to leaders in the community and talking to the community about making a plan. But one of the things we knew there would be a need for lodging. Lodging is a big issue there. So it sounds really bad, but it sounds really glamorous to go there and to stay with a host family as a volunteer or whatever. But it's kind of, it's hard. to go to that community. And I love them and I love going there, but it's just the truth. And so to get medical professionals or any kind of volunteers and for them to come back, you have to have good lodging. So we identified some good lodging, because there's not usually running water there. Electricity is dicey. There was a storm, so we had no electricity the whole time we were there. So.
Well, thank you for sharing that. And that, so I'm from Trinidad, almost always get mistaken from someone who's from Jamaica, but I'm not. I've actually never been to Jamaica before. But during my MPH program, I did a lot of my projects around Trinidadian health stuff. And to your point, I learned that there just is not that data collection that's happening, or many times the data that's collected is from 10 years ago or 15 years ago. And that is the best up-to-date data that is available many of the times. And just understanding that a lot of these places just don't have the resources or the infrastructure to be able to implement a lot of this same level of community health needs assessments that we see in the US that are mandated by the IRS just don't typically happen in a lot of these countries. So I think it's very important to understand that, as well as I love the point of you sharing you'll create this survey and then you're let's scrap this survey because it's not really helping us in understanding what we really need to understand, because the community doesn't understand it. So to that point, just shifting and focusing more on who are the people that we have relationships with and how can we utilize them to have conversations with other people in the community so that we can hear those stories and get that qualitative data from the people. And I could imagine that the data that you'll hear from those stories and the issues and barriers and challenges and opportunities that came up there would have been just so much more rich probably than you could have captured from the survey. I'm guessing the survey would have definitely captured a good baseline data, but I could only imagine the types of stories that you all were hearing from the community members. But that's awesome work, and I look forward to seeing what comes out of that next, or however y'all are looking to continue to do this type of work, because I think it's important.
And I know we need to move on, but I wanted to say, just to kind of color that, it was so interesting that one of the ways that we connected with people, we would buy them. So Mr. Morgan, who we stayed with and who I have a relationship with, the Morgans, and they have a bar. And so we would talk to people by buying them a drink at the bar. And so we also did community meals, but just two really interesting things that come to community health. So I knew one other issue. One is, transport access to care, right? So access is, it's roads. There's one road in and one road out to this community. And it's a very poor road. And so if there's, I don't want to say once a year, I mean once a month, it's constant that there's a roadblock. And in fact, we almost missed our flight because of a roadblock. And I actually had never been there during a storm, so I hadn't, but I'd always heard many, many times over the years about these roadblocks, but I really experienced it. And we were going to go to a community further up the mountain and talk to them and do a community meal. And we couldn't because of a roadblock. I mean, we literally could not get the food there. We couldn't get there. We tried to climb over it. Even when we climbed over, we couldn't get the supplies. So you see what an impact. I mean, just the fact. So if you're having a major health, emergency, you cannot get to help, And another thing that really hit me is they have no ambulance. So we totally take for granted just, something happens and we call 911 or whatever. That doesn't exist. Cheryl was telling me that a few weeks before we came, she saw a man doing, I think he was working on construction on the top of a building and he fell off. And her first thought was, oh, who's going to call the ambulance? And there is no ambulance. I mean, it's, it's just, but I mean, the stories can go on and on and on of what we take for granted. And I think one of the good things for me personally to go work there is that I'm so thankful just for little things like I have a cold, so I'm going to go down the street to the pharmacy, so.
Yeah, that's important. And I think that is one of the great benefits of being able to travel is just like seeing what life is in other places and seeing what's good, what isn't as good, what's different from the US, how is infrastructure not in place and like how that affects people, especially like I feel like especially when you're traveling with as a person with the public health lens, you really think about like how are these communities really getting those social determinants of health needs met or not. And then that really gets you to think of like comparisons to whether that's the US system, Canadian system, or whatever system you want to think about in many aspects. So I appreciate you raising that up.
Yeah. So you really see firsthand truly how the social determinants of health, like education, access to care, poverty, how it affects somebody's health.
Before we get back to the show, are you looking to be part of a community of like-minded people to grow your public health career and impact? Come join the early access waitlist. If you feel like you're forever balancing competing priorities, struggle to stay up to date with the newest trends in public health, or want to upskill your professional development, you're not alone. Come join our growing community of public health change makers where you can connect authentically, create meaningful relationships, build your brand, and discuss various career and public health insights. Early access to the community will open for a brief period of time starting on February 14th, so be sure to join the waitlist so you have the opportunity to be a founding member and help us build a stronger public health community together. Now back to the show. Absolutely. And then before we get more into your public health journey and how you became the founder of Moxley Public Health, what does public health mean to you?
I'm a community person, so I definitely like really think through the community lens, but often for us it does mean more of like a county or a town. But really community, I mean, we do some state projects and I think of a community, I've thought a lot about this. I think of a community as a state, it can be a country. I think of it as an area. But I also think that public health can be about anything. We joke at our company a lot that basically everything is we can take everything back to public health. If something is good, for my mental health, I'm doing that for my mental health. And so even though I haven't had lived experiences and walked through, in the shoes of many people, but I have had my own experiences. And every time like I'm doing an interview or thinking through things, I can personalize experiences that I've had and why it's been a challenge or, for me. So public health to me is taking a community and making it less likely that they will feel the negative effects of something that impacts their health. Is that a good definition?
Yeah, sounds like building resilient communities to me.
Yeah. Mm-hmm.
So yeah, I appreciate that a lot, and I feel like public health does intersect with everything and everything that is intersecting with everything as well. And we could always bring it back to public health, but just understanding that community can mean a specific population, it can mean a specific actual geographic community, it can mean a state, a county, a country, a region, and really just highlights like public health can be activated at so many different levels of society. So I appreciate you sharing that. You got your Bachelors of Arts in Sociology at Hunter College. What was that thought process going into undergrad?
Well, I can't tell you about the thought process. I'm not sure that there was a thought process. Okay, so I'll give you the real. So first of all, it was a long time ago. So that was like 25, 30 years ago. And so one of the things was that, and I used to think this was unique, but I think this means a lot to public health people, is that I was a pre-med major, I was a nursing major, I don't know, several other majors. And so a lot of people that want to go into public health, they don't know, they want to serve people, but they only know of like being a frontline worker. And at least I do think it's kind of slightly changing, but at that time, I definitely did not have the terminology of public health. I didn't know that I could go into that. I don't know that I used that term. And so after kind of switching around, I think I had several majors. I always say I could have I had enough credits to graduate 4 times with all the majors that I had. And so I ended up in sociology, but honestly, it was awesome. I think that it served me so well and served the journey that I didn't really know that I was, going to be on and that I was on. And I knew that I loved learning. I cared about people, cared about health, and I loved learning about different cultures of people. And sociology is that. And I was also a religion minor. And so I would take different classes on different religions. And to this day, I think of the classes that I had and learning about different people. And I think that, I know that it goes into a lot of my work, we do a lot of work around health equity. And I think just being understanding of how that affects people's health and really being hungry to learn from people and to listen is a lot about qualitative, research and data collection. And we don't know everything about every culture, but we have a commitment to learning and listening and realizing how much that affects people's health and also affects how we can make change in a community.
I think sociology is a great precursor. Some people would say it's the thing that you do after public health, but I think it's a precursor to public health because it does, as you're saying, open up your mind to cultures and how people live and just demographics of people and starting thinking about the idea of population. And I also think religion is very very much tied to public health and health. And even if we think of religion as something that maybe isn't so structured, but the community of religion and how that has shaped health and shaped how we are so important. And those are fundamental things. I actually have a friend who's doing a PhD around faith and public health and how those communities intersect and how we can benefit from utilizing and building better partnerships with faith communities to drive forward public health. So definitely think all those things are very much aligned, and I feel like undergrad is definitely a time for us to explore and understand. And having one of the best things about the US or the North American university system is that you are able to do a bunch of majors and transfer majors and still kind of not get set back as much as you would probably in other systems. And I think that is some of the benefit that you do get in being in the American system. So tell me more about why do you want to become a religion minor? How did that come up?
So that's another conversation because I grew up in a very fundamental Christian, not just a home, but area. And so I originally went for undergrad to a place called Cedarville University. And it was a Bible minor there because it was just more one faith, one religion. And I moved to New York City and I hadn't finished school. But I still was really interested in continuing these studies. But at Hunter, it was a religion minor, which really was I don't want to say better, but it was more interesting to me because it was all different religions and learning about different religions. So I think that was kind of how it happened. But again, it very much goes along with sociology, of just really loving and learning about people. And again, I didn't know back then how much that that it was about the connection to health for me. But now I know.
Yeah. Yeah. Awesome. Love that. And it's fun fact, one of the only notebooks that I have from undergrad still is one of my intro to religion classes. Because as you said, it is just so fascinating to learn about Eastern religions and then Western religions and how things are different, how things are the same, and just really learning about the philosophy that guides a people. I thought it was fascinating, and I still think it's very fascinating.
An undergrad.
I was a bachelor's in biology and minor in chemistry.
Okay.
Yes.
Those are the classes I failed actually, so that's why I had that's around nursing. No, you.
Failures on your redirection, so I guess that's where we need to get.
Absolutely.
Yeah. So before you graduated, what were some undergrad takeaways that you wanted to share with us?
Um, I think that I mean, first of all, that was a great experience. I lived in New York City, so that was all kinds of fun. And but the takeaways were just that no, all of our learning is for something. I didn't know that back then, but I think I've learned that in the last 5 years that there's really just no wasted experience. And that I don't think of that as wasted, but I just think that everything you're learning is a part of your journey and you don't realize that you're going to need it later. So again, just like us talking about sociology and, that I was a religion minor, I didn't think of it as health then, but I see how much that benefited my work now.
Love that. And I think that's like the mindset that we should approach public health week, especially because there's just so much that you can bring to public health with varied perspectives, varied experiences. And I think you spoke to it a little bit, just like the importance of lived experiences and valuing the lived experience that we all have and how we can show up and bring that into our work, which I think is really cool. So you graduated and you became a co-coordinator and health educator at Bronx AIDS Services. So tell us about how you come across that position and what do you do in it?
So I love this story because I honestly do not remember applying for this job. That's why I'm like, and those were the days, by the way. You didn't apply online. Like it was like you sent in your application and your paper resume, and then you got an offer, in an envelope in your mail one day. And so I remember that I got, it was like probably a large manila envelope, and I was like, oh, what is this? And I was job hunting, so I was probably excited. And I got this offer to come in for an interview. Come in for the interview from Bronx AIDS Services. And I was like, what? Because I'm telling you, I do not remember applying for this job. And so I went in for the interview. I'm like pausing because I'm like, should I, I didn't think I was going to get it. I'll just be honest. I was like it was in the South Bronx, and you can see the color of my hair and the color of my skin. And I got offered the job. I don't really know how. And it was amazing, an amazing, formative experience of my life. First of all, I learned about public health. I didn't know about public health. And yes, I was a health educator at this program called the Go Girl program. So Bronx AIDS Services is they serve people with HIV/AIDS, but this was part of the prevention department. And at that time, Black women, young women, Hispanic young women were the highest rising population for new HIV infections. And so Go Girl stands for something like Groups Improve Resiliency Learning, and I forget the Go part. But I learned, we did a whole program. And so it was a lot of relationship building. I really loved that. I still actually I talk to just on a constant basis, sending pictures of girls in that program. They're grown adults now. And so we just send pictures of kids and things, but that's because, they were in the program. I can't remember. It was several months. So we developed a close relationship. There were other health educators. So I was close to the staff, and we did, the girls came in once a week, but we had a few different groups. So they came in, we had a meal, really good food. I think, I gained some weight at that job. And we did a lot of fun things. We had a kind of different topic every week around health and life. And we did a lot of spoken word. We had a mentor program. And then I was the co-coordinator because I say co because our boss left for maternity leave. And my coworker and I co-led the program. So, we had already been there for over a year. So that's how it happened. I don't know. I'm kind of rambling, but that's where I learned about public health. My boss, Candia Richards, had a master's in public health. And that's kind of how it started. And I learned from her. I remember thinking too, I'm sorry to interrupt you, about to say something, that I had found what I was looking for. I had found my field. And so.
Glad that you're able to find your field, and it led us to this connection and this interview right now. What was that like for you to go from, I guess, to become co-coordinator while your boss was out at the time? Like, what did you have to like take on new roles? Did you have to like do more leadership, take on more tasks, more workload? What did that look like?
Oh, again, I don't remember, but I think that I don't know if I can say her name, but Charisma and I were we were co-coordinators together, but we had done it for so long that I don't think it was, I think that was fine. I don't remember that being a big thing, that we were coordinating the program. Because again, it wasn't like it was a month later after we started. We were a small team of women in this program. And so it was kind of a natural thing for us to take over when her name was Lisa, when Lisa went on maternity leave.
Okay. And you got your master's of public health at Boston University, as you shared. You shared that you learned about public health in this role. I'm guessing that's from both of the combination of doing like health education work, HIV work, as well as your boss at the time having an MPH. What was that thought process to make the decision to choose, okay, I want to do a master's of public health?
So I don't remember the moment that I decided that I wanted to go to graduate school for public health. But I do remember, because I'm all about like being transparent, and it's just that makes conversations more interesting and real. But I didn't get into Columbia. Back then, I think now there's a lot of schools of public health, but back then it was there wasn't very many, really. So I think that really my only choice was Columbia. I didn't get into their I forget what they were called. It was basically a community health program. And I didn't get into it. And I loved New York. I was really sad, but I got into, oh, no, I actually didn't get into it. If you just, let me be honest, I had such bad grades in undergrad because I changed majors so much, not really from the sociology, but I had changed majors. I didn't know what I wanted to do with myself. So I didn't have an awesome GPA. And so I basically begged my way into the program at the public health program at Boston University. But I was just really set. I made the decision that I wanted to go to graduate school for public health. I didn't want to leave New York, but I had to. So I drove up to Boston, and they basically said, I don't know what I was like on suspend. I don't know what it's called, but basically I had to get an A in the 3 classes. And little funny story, at APHA, the conference we were at, my biostatistician professor was at the Boston University School of Public Health host. It was really fun seeing her. And I was telling her the story that I had to get an A in that class. But here's the thing, Amari, I rock and rolled in public health school. I'm not sure, but I think I got straight A's all the way through. And that's because I loved what I was learning about, because I have that personality that if I'm not into it, I'm not very good at it, and I don't succeed. But if I'm into something, including education of some sort, I was like tutoring people in biostats. I loved public health school. So I got in, I obviously did well, and that was the journey. And then I moved to Boston.
Love that. Well, thank you for being transparent, first of all. I think that's important because other people out there might be in that similar situation where they changed a bunch of majors, their GPA isn't looking the best, but they're still trying to make impactful work, get an MPH, and you sharing that is helpful to them. One thing I think, like, tutoring people is one of the best ways to master the work and learn what you're doing and share it back to people. And then I think the highlight there is when you really find yourself in work that you are like passionate about, you're committed about, that you meet all these needs in your life, then it really does become a lot easier to do the studying, to do the work, and even though it mightn't always feel like a good time, or you might be doing the best all the time, it's just a lot easier knowing that, hey, this is something that I really love and I want to learn more about. And I was very similar in the same way. Almost graduated with the 4.0, but
neither here nor there. No one has ever asked me that in my entire life. So, but yeah. And then,
yeah. So tell me about you. Yeah, go on. About the.
no,
Oh yeah.
I was just gonna say that I think that's important because and just there's so many paths to realize public health or whatever your specific like work in creating a better community, better world out there looks like, whether that's like regardless of what it is, like just making sure that you're able to test out all these different things and work in different places so that you're able to say, okay, this is what I really like doing, and I wouldn't mind doing those hard research papers and staying up long nights to do the exams and all these other things because it's something that I'm passionate about. It's something I want to continue to build my career, my life around, as well as I feel like the skill sets you learn in public health is just so transferable to so many things. And as we shared earlier, public health is everywhere. So there's just so many ways that you can take the skills, the knowledge, the topics, and just like transfer that or take that into your career. So I appreciate you sharing all of that.
And I just want to say the only time my GPA ever mattered was getting into graduate school. So I guess it mattered because that was but it's the only time I ever cared. But graduate school for me, just, I know we're going to go on, but it really wasn't hard. So it's not that it wasn't a challenge and I'm not proud of it, because I am in grad, but because when I loved it so much, I don't remember not liking it ever. And I worked full time. I was a fellow. And so, but I was just loving life at public health school.
Well, kudos for you for that, because I think like doing that full time and feeling good about everything is not easy. But it just shows, I guess, like the passion and your desire to do this work, which is very, very important. So during your time at Boston University, you were a research assistant for the Youth Alcohol Center at Boston University School of Public Health, as well as a social and behavioral sciences fellow at the Boston University School of Public Health. Tell us about those experiences.
So they had this great program at BU called, I think it was like the remission tuition remission program. And so I can't remember, but I got this great job as a research assistant at, so at the school, they had a program around adolescent youth alcohol use and also marijuana use. And I worked with that full time, but it was honestly it was a great full-time job to have because they were definitely like flexible about like if you had a class, you would just go across campus because it was at the Boston Medical Center. So we conducted the research out of the pediatric unit emergency room at Boston Medical Center. It went to age 21, and we basically would screen patients that came into the emergency room for alcohol and marijuana use. And then we did motivational interviewing if you know anything about that. And so that was a really cool program. And then I was a fellow with Dr. Anita Raj, and she did HIV prevention work. And so I was an evaluator. I helped with a lot of evaluation on that. So I learned about evaluation and that. But what I also really learned about, which is to this very day, serves me, is we adapted, call them EBIs. I don't know what they're called now. I think they're still called EBIs, but evidence-based interventions for HIV prevention. There's an EBIs for lots of different health topics. And, so I remember we were adapting a program, I don't remember what it was called, for a group of men in Russia. So that was interesting. So I learned about adaptation and evidence-based interventions and adapting them for different populations and different places. So that's what I did.
Awesome. And throughout your time, like getting your MPH, did you have an idea of like what you wanted to do afterwards? I know you spoke a little bit earlier to like knowing that health education was something that you really enjoyed. But was there any idea going through the public health program, like what are my next steps after this?
That's a really interesting thing to bring up. Thank you, because I'm kind of like, I've been thinking about that a lot, and I've become passionate about that in the last few years. I don't remember that. I mean, Boston University School of Public Health was awesome. Like, there were just brilliant professors. I had great experiences there all around. But really, they never talked about what you were going to do with your public health degree. And the only thing I knew was like academia and working at the Department of Public Health. I didn't really know anything else. And a few times I taught a class at a public health school on how to do a community health needs assessment and data visualization. And I think it was really cool that it was taught by somebody in the field that's doing, things in the field. And it got me thinking that really more universities should invite people in that do lots of different things, because the only option is not academia and working at the Department of Public Health. But I think that that's kind of what people, or maybe working at a program, all great, fabulous things, but just there's so many options. And so I think that could have been done stronger, because I didn't have an idea. That's the answer. Yeah.
I resonate with that a lot. In the sense that I had no idea what public health was, got into my master's of public health, and I was like, oh crap, this is a field that people do work in. And then just realizing like all the different things that people do, but then most of the time just hearing mostly about governmental public health, or public health and like health administration spaces. Those were the main things pushed onto us. And it really took me wanting to say like, okay, like I'm doing this degree, like what are all the things that I can do, and really like building my network, using LinkedIn, using like to reach out to people to see what jobs are out there. And that is like really what led me to like creating this platform and then creating this podcast, is because I felt like there just wasn't a lot of guidance as well on like what are the things that you can do in public health. And many times it is like public health is just so broad, many of us don't know which part of public health we want to get into. So just like I'm appreciative for you sharing your story now, because I think this is like one of the ways that we support the next generation or people that are currently in the public health workforce of like thinking through, how do I approach my career in public health? What are the steps that I can take to get to maybe a different position, different part of public health? Because it's not something that is easily available. And I think that's one of the things that we fail to do as public health professionals, is just like more broadly share that like these are all the awesome ways that you can get involved in public health. So I'm grateful to be someone that is helping to share that, and I'm grateful to have you on to share your story today.
I'm grateful too, and maybe we'll talk about this later, but I'm very passionate about just like hearing about what other people in public health do. Yeah. So I can share at some point like podcast or something that I need to listen to.
Yeah, absolutely. Because I think that is essential, because we do not know all that happens in public health. Even me with 180 episodes of this podcast out now, I do not know all that happens in public health. So I think it's just important.
You can get a good job. You can get a job, and you get a good job in public health, just so you know.
Absolutely can. And then before we move on to after your MPH, were there any other takeaways that you had from your MPH program that you wanted to share?
I don't know, a lot. I feel like I don't want to say much, but I don't want to take over so we can move on. But it was just a great experience. Okay. So we can talk more, but I think that it was just a good time in life because I just was learning so much. I was excited about public health. I think I was excited about this field that I didn't know about. I loved the people that I was surrounded with. I don't honestly think that that was a new experience, that just learning from other people and people's different ideas, both my professors and the other students. And so it was a really great experience. And I worked at the University of Public Health. And so I went to school there. So I feel like I was very immersed in that world. All my roommates I think you met one of my roommates, Shauna. Did you come on the day that Shauna was there?
I don't think so.
Okay. Shauna lives in Atlanta. And so I lived in a whole house of other public health students. And two of them I'm like super duper close to this day. And but yeah, one of them lives in Atlanta. And so she helped me on Sunday.
Love that.
Mm-hmm.
Love that. Highlights the importance of connections and just how relationships can really develop and flourish over like a career and a life. And after your MPH, you became an emergency preparedness coordinator consultant at Logan County. Tell us about that.
I had moved back for just a few months to where I'm from. And Logan County Health Department is I live in Logan County now. And so they were working on their emergency preparedness. So I haven't done a whole lot other than my needs assessment work for sure. But that was great because they were just really starting an emergency preparedness program, or I don't know if you call it a program, but they realized that was a big need in their health department. And which fast forward of 20 years, that was probably helped a lot during the pandemic. And but it was identifying different groups of people that would really need help during a pandemic. For that, it was in that community, it was a lot of people with disabilities and senior citizens. And yeah, so that was a great internship. It was short, but I learned again. I didn't really ever think hard about emergency preparedness, but all these years later, it constantly serves me that I know a little bit, Yeah,
you just gotta take that experience and put it in your back pocket for whenever that time comes up when you need it.
Mm-hmm.
So you were a public health consultant at John Snow, but I'll ask you about that after I ask about this one, because you are also a grant review panelist at the Office of Women's Health, Department of Health and Human Services. This is not something I get to ask people much about, so I love to hear more about like not only becoming a grant panelist, but like what was that process of like reviewing grants for you all, and just share more about that.
That was actually way later, from during those years when after I quit JSI, John Snow Incorporated. And I was staying home with the kids. So kind of in between projects, and once in a while, I would review grants. So, we apply for stuff now. And so it's always like really interesting to have been on the other side and to know really what's important. And I can talk to you sometime if you ever are interested in that. It's actually it's a really great experience. It's a great filler because it really takes like a couple weeks and you get paid for it, but they're looking for a lot of people to review grants because you can imagine how many they have coming through the door for different stuff. And I did it through Health and Human Services, and you would get a handful, like 12 to 15 applications, and you would have a scoring rubric, and you would just spend a couple weeks just pouring through them and score them. And then you would all come together as a group. And I think everybody scored the same one. So that a lot of people were scoring the applications. And so I mean, for the good and the bad, I saw the other side of it. So I always if we do a large RFP, I'm always like, guys, like bold lettering and large print, say what it's about, because really you get it's so important that it's very clear that that's included, that whatever they're asking is included in your application. So,
especially for, I'd imagine at this level, it's probably like long grants, and these people that are also reviewing it have probably other obligations. So like really trying to make it as easy as possible for them to really know like what are the big points that you are hitting on here is very important. And then like to your point, and I guess the theme of this is like taking that experience as being a grant reviewer and now like you actually using that as a consultant in the work that you do, I think is something that I think continually comes up in this conversation. You were a public health consultant at John Snow Incorporated. Tell us about that position.
Okay. I feel like I'm a broken record because over and over I'm like, I don't know how I got the job. One, two. My life is like one big, like, things happen for a reason, you know? And so I always say that, like, after graduate school, like everybody, I needed a job, you know, and I had a few places that I was really interested in, and John Snow was one of them. But it wasn't like I was like, I'm going to be a public health consultant. That's what I wanted to do. I just wanted to get a job. And so I got the job at John Snow Incorporated. Again, you know, to public health students, that was because of a relationship. You know, I knew somebody who knew somebody, and I would not have gotten an interview, honestly. Like, it was a really, like, competitive place to get a job, especially for young people. And so I got the interview and I got the job, and it was probably a favor, but I got it. And but that introduced me to the world of public health consulting, which I'm still in today. And the reason that was great was because as a consultant at a large public health firm, I was working on, like, you know, 6 to 8 projects, you know, 10% here, you know, that's how they do it in consulting firms. You're on this project for 10% and 15% and whatever. And, but I worked as anywhere from on lots of different projects, from as small community-based projects, which are definitely my favorite, and to some CDC projects, federally funded things. So I think I had my hand in a lot of stuff. At that, it was mostly HIV work and sexual health work, mostly around evaluation at that point. So, but again, in different those kind of roles in those different projects.
Before we get back to the show, are you looking to be part of a community of like-minded people to grow your public health career and impact? Come join the early access waitlist. If you feel like you're forever balancing competing priorities, struggle to stay up to date with the newest trends in public health, or want to upskill your professional development, you're not alone. Come join our growing community of public health change makers, where you can connect authentically, create meaningful relationships, build your brand, and discuss various career and public health insights. Early access to the community will open for a brief period of time starting on February 14th, so be sure to join the waitlist so you have the opportunity to be a founding member and help us build a stronger public health community together. Now back to the show. I like the trajectory of you saying, well, of you like getting into this consulting position at a large organization where you're able to like interact with consulting at a high level, at a large scale, on multiple projects, so that you're getting to see all various aspects of the consulting process, as well, probably like working with different clients, getting a feel for like how different people are approaching work. And then from there, you kind of worked into starting your own consulting at Moxley Public Health.
Mm-hmm.
So I know you shared a little bit about that transition a little bit earlier, and it having to do somewhat with the birth of your children. Can you tell us more about that transition, and like what was those initial first stages of Moxley Public Health? Did you know you wanted to become like a full out consulting firm, or like how did that go about?
I definitely did not know that I wanted to be a full consulting firm. So that was really just what I said. You know, I was having children, so it just didn't kind of jive with my lifestyle. I didn't burn bridges. Again, another little tidbit for public health students. So I still have a lot of relationships at JSI. It just wasn't working for me. And so my children are really close in age. So they're 14 months apart. So I was just busting them out. I was and so but I remember actually going into labor with my first child, and I was writing a report or something, and but I really loved that stuff. So but that's how Moxley Public Health was born, because but it was truly like for almost a decade I was doing, not always, but really just 1, maybe 2 projects at a time, very part-time, and then I would be a review panelist here and there for Health and Human Services. And so the transition was several years ago, right before, a couple years before the pandemic. So like maybe in 2018, I was like, okay, I'm ready. Like I really need this back in my life. And so it was my chance to like pivot and think, I guess. And so so at first I was a generalist, and meaning that I would almost do kind of anything that somebody needed a public health consultant for. And really it was, I always tell her that she was one that told me this. Dr. Huntley, Charlotte Huntley, was, and I know you know her because I've seen a picture and you know that you guys know each other. And she told me, like, Stephanie, you should really niche down. And so I did. And I was listening to a lot of podcasts, including her podcast. My friend Sajani now on PH Spot, yours, and just kind of hearing what other people do. I wasn't to listen to yours then, but that's why that's so valuable. I listen to it now. But just hearing what all the things that people in public health do. Well, at some point I heard about that hospitals and health departments are required to do community health needs assessments. But I really like doing them. So I did that as an evaluator, sort of the first step of evaluation of starting a program, because I did program evaluation. And so I learned about that. And I was doing other things. I actually had a dream job as a consultant with Partners in Health. That was one of the reasons I got into public health, at building a training program for adolescent mental health in Haiti. It was awesome. But at that time was when I really wanted to start niche down. So I was doing that project, but I was starting to think about getting a contract. My first contract was with a hospital to do their community health needs assessment. And hospitals, it's the same thing, but hospitals call it implementation strategies. Health departments call it improvement plans. It's really the same thing. So that's it. So
Yeah, well, thank you for sharing that. I think that's important. And how was that advice from Dr. Huntley, like of like really getting focused on going away from being a generalist to like being specific in the work that you're offering? How has that helped the consulting org?
Yeah, and so like I want to say, like, if that's working for people, they've had like to be a generalist, like great. But I do think that in general, niching down to like an area really helps. Like, I think she was just saying, like, if you really want to scale your business, and I did, and I do, is, go down. And so I found this area of community health needs assessments. And I always say, like, again, like a piece of advice to people in public health or students is find something that you enjoy doing, but that you can get paid for it. And that's not maybe the right thing to say. Maybe it is or isn't, but it's just the truth. And because if you can't get paid for something, that's wonderful. We don't need to get paid for everything, but that's might be a hobby or something we enjoy, And so I found this kind of gold place that I really like to this day. In fact, I even love it more and more all the time, doing needs assessments and improvement plans with health departments and hospitals. And so I found that, and the way that Dr. Huntley described it to me, I'll never forget, and I use this constantly, was like, well, if you had an issue with your ear, who would you go to? Would you go to your, general family physician, or would you go to a ENT, ear, nose, and throat doctor? Well, of course, an ENT. I got to go to a specialist. And she was like, yes. So that's so Moxley Public Health has taken a turn, but the last 4 or 5 years, it's been about needs assessments. And the cool thing is, the way you get really good at something is when you do it every day. That's all we think about. That's all we do. And so, yeah, we live and breathe needs assessments. So I think there's really something special. Like, people are very drawn to companies or consultants or whatever it is when they're when they specialize in something. So probably, a client is going to choose us over another consultant that does many, many other things, because needs assessments and improvement plans are all that we think about and do every single day. And we constantly are learning about them and improving them, and learning things that we didn't know and getting better at something. I know you do a lot of health equity work. In the last year, we have gotten really particular about how we identify health disparities in a community, and then how we address them. But, we think. I think that, somebody that's doing another company that's doing a lot of other things wouldn't have that time to think that through, as little skills like that.
Yeah, that's very, very important. And if you're able to always like get in the mix of like passion and work that pays, that is like perfect. As well as I think like the specialization of the consulting work is also easier to market to other people, to say like, hey, this is what I specifically do. And then to your point, like they're more likely to go with you because you are doing this day in and day out, and this is what you breathe, sleep, eat, and repeat doing. So definitely feel that. And then Moxley Public Health has seen some growth over the last few years. What has made this possible?
The growth?
Yes.
Well, first of all, hiring. So I have learned that, I'm sure when I went out to hire that...
Oh, you were stuck. Can you hear me?
Yeah, I can.
It cut off after you said hiring. So first of all, hiring.
I'm sorry. I don't know if that's my connection or what. When I went out to hire and knew I needed to hire, it was probably, I can't remember, but it was probably more about the amount of work, and that is true. We have a lot of like little sayings at our company, and one of them is many hands make light work. And so it's not just for our stuff as a team, but also for our clients, because we encourage people to, in a community, that it's not just the hospital or the health department that does all the work. It's all the community partners together. We're big on collaboration and working together, but it's also within our company. And so we all work together. But I think what I didn't realize was equally as strong was that our work is so much better when many brains are in it. And so we're all smart. It's all women. We're all smart women. But we're human beings. We're not going to come up with ideas that the next person has. Also, we all have different experiences. And so that's brought into it. So I think it's as equally as important as just hands in it to make the work easier, as that we offer. I feel like we're such a better company than if it was just a one-woman show, me. And because everybody brings so many fabulous ideas into it, and I'm just all giddy, and I get excited every day with the team, the cool ideas that they have. And so
I love that. And I feel like that is a difficult prospect for many people that are starting in consulting, to think about hiring people, working with people, and just like not taking on the entire burden of the work by themselves. But like to your point, and I think there's this book that's called Who Not How. It's not to think about how you can do it, but think about who can do it for you. And to that point, is like you might have an expertise that you're really great in, and then something that you're not really great in. So who is the person that you can get that is great and as well probably likes doing that type of work is important. So I appreciate you sharing all of that. What do you enjoy most about being the CEO, founder, and public health consultant at Moxley Public Health?
I pause because I really enjoy it. I didn't know, for one, I honestly didn't know I love it's a hard word to say, entrepreneurship.
It is.
I definitely didn't ever set out to be in it. I didn't know anything about it until a couple years ago, but I actually really love it. And I am learning all the time. I'm just putting one foot in front of the other, because being an entrepreneur is not really about public health. It's like building a business. So it's just like any business. I listen to business podcasts, and I'm part of a business women, like some women's organizations. Actually, I can share them if it helps people.
Yeah.
So for a public health, I really recommend PH Spot. It's actually how I found some of the people on my team through PH Spot. Sajani, I don't know, you know Sajani, but she, anyways, that's great. But then that's geared on public health, but there is one called Hello 7. I might be the only public health person in it. I don't know. It's for women and people in marginalized communities, but I feel like I learned so much about not only just skills, but a mindset of being a CEO and entrepreneur. CEO school is really good. I just listened to an episode this morning, and so I learned, I enjoy that. I enjoy the excitement of getting new clients. I'm not going to lie. That's probably like business building. I like how we're always evolving and learning new things. So an example is that when we first started out, it was I guess. When I first started out, I was very IRS minded for hospitals, but we've become really more so FAB minded, Public Health Accreditation Board for health departments. And so I love how just constantly there's just so much to learn. And again, that's the reason it's really fun to niche down and to specialize in something, because you have room to really like learn constantly about one little, tiny skill. And I am a people person, and I like to talk a lot if you haven't, picked that up. And so it's all about it. It might sound kind of like nerdy to some people, needs assessments and improvement plans, but it's not at all. It's all about building relationships, going into a community. We often we're with a community for over a year. So it's, we really almost, I feel like I'm part of that community. I learned so much, and I like those relationships, and I get really close to not only the community partners, I meet them, but I get super close to our point of contact people at the health department and hospital and at some community organizations. So I could go on and on why I love it, because I love it.
Love it. I love that you love it. And I think it's important that we do find work that we do love, and we make those connections. And I also love the point of view, just continually pushing yourself to learn and like sharing resources that you use to learn, because I think all of us are always probably in a learning phase as we are developed, whether that's personally, professionally, or a business.
Mm-hmm. And I also think too, this is just, I work at a small business. So I am the CEO, but even my team says this, it's really fun to work at a small business where we don't have any corporate barriers in front of us. If we want to do something, we just do it. That's how the Jamaica project came. We didn't have to jump through any hoops or get permission from anybody. We were just like, let's do this. This is so important to us. And so it's fun to work at a small business for those reasons.
Love it. And what do you see the future of Moxley Public Health going within the next few years?
Getting better and better at community health assessments and improvement plans. I don't see, sometimes, people will ask me to do a project that is kind of outside of that. And then I have to realize I'm going to stay on my mission of community health community health improvement plans and health needs assessments. So I'm just looking forward to getting better and better at those. We're really big into data visualization. So I want to improve on that. Like I said, this year has been a really big year about getting a lot better at identifying and addressing health disparities in communities. So I want to get better at that. I just see us growing, and then the more people coming into the team is where I see the vision just growing. I like what we're doing, and I don't see, we might have ideas, we have a toolbox package where our service is more, we sell our intellectual property, but it's community health assessments and improvement plans. And so I see us doing more community work, and like the Jamaica project. So that's it.
Awesome. Well, I look forward to seeing the growth of Moxley Public Health, and I am here rooting for you all as you'll continue to do great work.
Thank you.
You're most welcome. And moving you on to the Furious Five, the 5 questions that I ask all guests.
Mm-hmm.
So, number 1, what advice would you give to a student trying to pursue a career in public health?
I looked at the time. Sorry, this is going to be a long one. So I would say definitely experience, embrace all your experiences. Even if you don't think that you love an experience, embrace it and know that later on it's going to like resurface that you're, oh, I had that experience. I'm so glad. Listen to learn about what other public health people in the field of public health do. I can't say that enough. I didn't know about that really until several years ago when I was going through that transition of niching down and figuring out which way I was going to go with my consulting. And I started listening to, I'm already like a podcast junkie. And so I was just listening to Dr. Huntley's. I wrote it down. I always, I think it's like an epidemiology. I want to give you the right name. Public health epidemiologist, so Johnny's PH spot, your podcast, and just hearing all the things that people do in public health. And I think that's really helpful. And listen to others, but don't listen to others too. Follow your heart. So definitely listen to other people, but then also if there's something in your gut that people are saying is a bad idea, it's probably a good idea. So.
And before I move on to the second question, I like that a lot because many times people don't have the same visions for our lives that we do. So what they could be pushing onto us mightn't be the things that we need to receive. So completely respect that as well. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Mm-hmm. I mean, I think it's like the same, as the first question, just good experiences. Learn constantly. I'm a very curious person. So that, again, I think I've said it before, but it served me well in this job. And even though we know more and more about community health needs assessments and improvement plans, we don't know everything. So also there's new things, but we also have a lot to learn. So, in a few weeks, we're going to the MAC 2.0, training, which public health departments will know all about. It's a big deal. And because we want to learn, we're committed to learning and being able to speak to things really well and to help health departments. We're learning about a system called Clear Impact. It's an evaluation sort of progress report of your strategies and intervention. So constantly we're learning and we're committed to that. And I think that, for people getting into public health to do the same thing.
Number 3, what's something you're working on improving in your life right now?
I feel like this is cliche, but slowing down a little bit. I don't apologize that, and I don't want to change that. I'm a really motivated person that likes to do a lot of things, but I think as I get older, again, that sounds so cliche, but it's true. I realize I think a lot, daily, several times a day, about whether decisions are a decision that matters. And this sounds kind of crass, but I think about things, if I have a deathbed or if I'm an old lady, what that old lady or that person on the deathbed would say to, Stephanie now. And so sometimes it's personal decisions, just spending time with my kids. When I'm working late, I'm like, this is stupid. I can do this tomorrow. Go hang out with your kids. That's what I'll regret that I didn't do. But making sure that all my work, I feel so fortunate that the work that I do really matters. I think it's really, really matters that I'm going to leave the earth better than when I came to it with my work. And that's a wonderful thing to be able to say. And so, my kids are most important, but second to that is thinking about things in my professional life, that I'm going to be so thankful that I did, like the Jamaican project, and hearing about my clients in the health department and hospitals. So,
yeah, thank you for sharing that. Number 4, professionally, do you recommend anything?
Oh, like any books or
Yeah, books, resources, podcasts, etc.
oh yeah, sure. A lot. So I made a list about podcasts or books. And I'm probably missing some. So I made like a quick list what came to my mind. Right now I'm reading Evicted. It's about, have you read it?
I got the signed copy. I got a signed copy from Matthew Desmond because I met him.
Okay.
But I have not read it as yet. I read his other book, Poverty by America.
Oh yeah. So that's really good. It's about families in Milwaukee. It's around like poverty and housing. So it reads really easily. The Color of Law, which I got from you, from one of your list. I'm listening to that on Audible. That is better for me in life right now. I'm kidding myself if I, am going to read a book. So it's easier for me to listen to things. So Audible, if actually that in itself is a big, I promote that. I tell people, I'm like, listen to stuff. Like when you're in the busy season of your life, or if I have a friend that has dealt with dyslexia a lot, she listens to a lot of books, like listen to books. A lot of books that I say I read, I listen to. And so, Bias. Have you read Biased?
I have read Biased, yes.
Was good. And I know that it means a lot when if I have like a few minutes and things come to my head. I read that a few years ago and that was really good. If you haven't read that. Another one is What the Eyes Don't See. That's about the lead in the water with children in Flint, Michigan. That was really interesting. I just binge listened to Unreformed. Have you listened to Unreformed?
I have not.
On podcast. So it was about I don't know what you call it, school. It was a place where kids lived, which was really sad in Meigs, Alabama. And so just listen to it. It's about like the injustices that went on there for these children that were in the justice system, but a lot of them didn't go there because they like stole something. They went there because they couldn't be taken care of. But it was just, anyways, it's just so interesting to listen to. And that's it. I'm sure I have a lot more because I love books and podcasts. So I'll think
awesome
tomorrow or tonight that I should have said.
Yeah, and if you do want to share more, feel free to share them with me by email, and I will put them in the show notes. But a lot of great resources there, some that I have read, some that I have not, and I look forward to I'll definitely check out that Unreformed podcast because that is fascinating.
Oh, it's so good.
Awesome. And then question number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
I wrote very quickly, like, that don't people please. This is a big thing for me, honestly, in the last few years. And I'm like a, recovering people pleaser. And I feel like I've spent so much of my life doing things to make other people happy. And I think it goes into a lot of career stuff too. A lot of us choose career paths to make other people happy. So you have to make yourself happy. You're the only person that really is going to care about, your life.
Absolutely. Great advice. Mm-hmm. Thank you so much, Stephanie, for coming on today. I really appreciated hearing more about your story, talking to you, getting to connect with you, and I look forward to meeting you sometime again in person.
Great. We'll have to talk about what conferences we'll be at to make sure we see each other. Thank you so much for having me.
Truly is my pleasure. I had a lot of fun today. So housekeeping items, everyone. Thank you all so much for watching. If you have not as yet, be sure to subscribe, be sure to leave a review, and share this with a friend. Greatly appreciate it. Have a great rest of your week, everyone.
Thank you.